If you've been injured in an accident, even the slightest bit, you'll need to go through physical therapy. Now, it can help improve your range of motion and provide pain relief during the healing process. It's important to know what to expect when seeking physical therapy, what it entails, and tips for recovering quickly. Being prepared will make it easier on both you, the patient, and your physical therapist. This video will be a great resource for anyone who has been recently injured or is going through physical therapy after a car accident. In this video, we will cover everything from how to get started with physical therapy to what to expect in physical therapy. Hi, my name is Dr. Joseph Rosie. I'm a licensed physical therapist, and I help active adults decrease pain, recover from an injury, and increase performance so they can live their life to the fullest without unnecessary injections, medications, or surgery. Now, I do this by working directly with you one-on-one in person or virtually via our app. Okay, so let's say you were just in a car accident. Let's briefly go over what to do. Hopefully, you first get pictures, possibly a police report, get seen at the ER or urgent care depending on the severity, and possibly speak with an attorney if you choose. After, you may be left with some aches and pains that have you wondering how you're going to get back to the things you love. The good news is, the earlier you seek treatment, the better the outcomes will be. Here in Florida, you need to seek out treatment within 14 days of the accident for it to get covered by your auto insurance. This brings me to my next point. Who covers physical therapy in the case of an auto accident? Well, believe it or not, your health insurance does not. This is not something I'm the foremost expert in, and one of the reasons you may want to consult with an attorney, but typically you will need to open a case with your auto insurance. Once you have a case and you are assigned a claim number, you will use that claim number for medical providers to submit bills on your behalf to your auto insurance company, which will allow you to get seen for medical expenses, including physical therapy, at no cost to you. So that's typically one less thing you're going to have to worry about. Next, most people are curious on what to expect and how it works. Well, in this case, it works pretty similar as it would with any injury in the case that you first need to get an initial assessment. From there, your physical therapist will sit down with you and help devise a plan that will help you reach your goals in the shortest amount of time possible so you can get back to the things that you love. For what really to expect in each therapy session? Well, that kind of depends on what is going on with you. I say that because most of the common injuries following a car accident can be broken down into three categories: a fracture, a muscle or tendon strain, or a ligamentous sprain. Each injury will be associated with one or more of these. For example, a disc bulge or disc herniation is actually a ligamentous sprain. Let me explain. The outer layer of a disc is called the annulus fibrosus. It's actually a ligament. When this ligament is sprained, either grade 1, 2, or 3, it can cause the nucleus inside to push outward, causing a bulge. This bulge may then be pressing on the nerve, causing some radicular symptoms down the arm or the leg. The thing is, most people in this instance are worried about the radicular symptoms or the disc bulge, when in reality, the disc bulge, and therefore the radicular symptoms, are actually secondary to the ligamentous injury. I like to think of it this way. The disc is the victim, whereas the ligament is the culprit. Now, the entire role of the ligament is to limit motion or movement. In this scenario, the ligament's role is to limit the nucleus from protruding outward. But due to the shearing forces of the accident, the ligament could have been sprained, thus causing that disc to bulge or herniate. Now, it's important because regardless of the bulge or herniation happening in that moment in time, the ligament is still sprained, meaning it's currently weakened, leaving you at a greater risk of injury in the near future. Now, even more so, the ligament's role is to limit motion. So as you can imagine, after a car accident, the body wants to approximate so these tissues can heal. For example, let's take a cut on a wound. If you cut yourself on your arm, you would see that body lay down a scab and bring the two ends of that cut together in order for it to heal. Well, internally, the exact same thing happens. Your ligaments connect bones to bones, and in this case, the vertebra together. So when the ligaments are sprained, there's a gap in the fibers of these ligaments, right, that need to approximate together in order for this to occur. And for that to occur, the muscles of the low back or neck will then need to tighten up and create stiffness in these joints to allow the healing to occur, similarly as it would in that cut. Now, this will typically cause muscles to get really tight, where often many doctors might prescribe muscle relaxers. This is literally fighting your own body against it from healing itself. The goal in this brief period of time is to limit motion to allow your ligaments to heal, right? Because the reason is 50% of tissue healing is going to occur within those first 2 weeks, which makes it the most important time to address these injuries. Now, to complicate things a little bit, car accidents are more variable than other injuries because first, you have the impact from the accident, and second, how you moved or how your body really moved from inside the car. But That alone can cause secondary injuries from the first, injury to compound. Now, it's not uncommon for someone to have multiple injuries at the same time in which they need physical therapy for. Each of these things are treated differently, and I'll make a follow-up video on the major injuries following an accident and how we can address them. I'll leave a link to the follow-up videos in the description below once they're posted. So that's the initial assessment, checking to see where you currently are and any injuries that you have sustained. Once you're a therapist and you have agreed upon a plan, your therapist will work with you and help you decrease pain by employing a number of therapies, including joint manipulation, soft tissue manipulation, and corrective exercises, as well as maybe using some modalities such as a TENS unit. Now, each person will differ with how long therapy will last, but in a general sense, it may take up to 3 or 4 months, sometimes even longer, but it really all depends on the severity of your injuries. The goal is ultimately to get you back to doing the things that you love without limitations. So I hope you found this video helpful. If you have, do me a favor and give it a thumbs up. Subscribe to the channel for more videos like this. Thanks for watching, and I'll see you in the next video.